So Charcot foot is a condition that is most commonly associated with diabetes, and it's where the foot or the arch of the foot collapses. And instead of having an arch, the foot becomes flat and it no longer functions normally. And because of that and diabetes, oftentimes an ulcer or a wound will occur, and it's an increased risk for amputation. Well, there's two theories. It's probably a function of both theories, that people with diabetes lose feeling in their feet, so they can't feel the trauma. And also, the same nerves that go to the sensation to make you feel also go to the blood vessels, and they make the blood vessels open up very big. And that washes the minerals, like the calcium, out of the bones, and it makes the bones very soft. So if you have trauma and soft bones, it causes fractures and collapse of the arch. Yes, the earliest sign is a hot, swollen foot. And if you have a hot, swollen foot, most times with no pain, but a hot, swollen foot, it should be thought of Charcot foot until proven otherwise in somebody with diabetes. And the most important thing that you can do at that point is to stay off of the foot, not put any weight on it until x-rays are done and a specialist sees the foot to determine if it is Charcot foot, because the amputation can be avoided then when we have an early sign and early intervention. Offloading is the most effective way to prevent the Charcot foot from becoming destroyed. But once it is destroyed, then we have to do surgical reconstruction to change the way that the foot is balanced, and sometimes actually break the bones in the foot, reposition them, and then fix them all together again. Something that takes not only a long time in the operating room, but also a long time of recovery. So it's much better and faster if this is discovered earlier, and then just with not walking on it can prevent all of these complications in the future. In terms of the diabetic foot, we often times don't talk about a cure, and instead, just like cancer, we talk about remission. Because when we treat it and there is some recovery, there's always a risk that it could come back. And so we have to protect the foot and prevent it from having abnormal pressure. And so we use the same terminology that we do for cancer, because if you look at the death rate actually from complications of the diabetic foot, it's higher than many cancers. And that seems amazing to think that a foot problem can have a high mortality rate, but it's true. It's higher than many cancers, higher than breast cancer, colorectal cancer, throat cancer. You know, so it's really one where we can make this comparison truthfully to cancer and say that we've put the foot in remission. But we're very careful to pay attention to see with checkups if any problems are coming back. In general, and with a diabetic foot, that depends on your risk category. And so most of the time what we're doing is a 3-minute foot exam to determine someone's risk for future complications from diabetes in the foot. And once we've categorized that risk, if it's the highest level of risk, it's every 1 or 2 months. And if it's the lowest level of risk, it's once every year. So it's, and then anywhere in between there are more frequent visits. The nice thing about a 3-minute foot exam is it's meant to make it easier for general practice doctors, endocrinologists, other medical doctors who are not foot specialists, but who are taking care of people with diabetes and need to make a determination of whether or not this patient should see a specialist. And so what the 3-minute foot exam does is it only takes the most important points of the exam And that's based on the history of the patient. Sometimes if you've had a previous foot problem, you're in a very high risk. So you ask about that. You also ask about other symptoms that the patient may have. And then you go to the exam part and you only look at the things that really make a difference in determining their risk. Such as a range of motion. So if there's a abnormal range of motion, let's say that the ankle can't bend very well or the Achilles tendon is tight, that's a big risk for getting an ulcer. If there's a callus somewhere and that callus is discolored, we say that that's just like having a lump in your breast. And we should think about it the same way. You look at this and that's a warning sign that there is going to be a future problem on the foot. So we concentrate on those easy things. A lot of it are visual, so the doctor doesn't have to do a lot of a very extensive exam. But with just a little bit of history and a visual inspection, they can make the determination of if they need to see a specialist and how fast. Exactly. So the risk category then translates to the frequency of the visits afterwards.